gigantic factor. It also depends on the type of pain that you're dealing with.
It's a bird.
It's a plane!
It's the Glute guys.
Howdy, everybody. Today, we have another fun topic. Have you ever been sitting in your chair or walking around and noticed, oh, my back hurts a lot? Today, we're going to talk about when you should go to the doctor and some quick tips for people who have never had back pain before and how to manage it.
Yeah, so this is going to be the first video in a whole new segment that we're doing, specifically based on things that Aaron and I like to think we know a thing or two about from going to grad school. This one's going to be all about lower back, something that we've been thinking about a lot, because it's something that both Aaron and I have personally dealt with. And it's one of the most common things that everybody deals with, especially in injuries. About 80% of people experience lower back pain in their lives. So it's pretty prevalent. It's a big problem. And we want to start to share a little bit more about when you need to worry, who you need to see, and some things that you need to do. So this episode is purely going to focus all about the when do you need to call your doctor? What are some more of the serious signs that we need to worry about?
Yeah, and back pain is one of those things that, unfortunately, once you get it once, it's very easy to happen again. So we want you to know, like, okay, if it comes back, is it just you go right back to your routine? Is it time to go get it checked out? Is it time to do whatever you need to do? I know me personally, I've hurt my back originally actually water skiing, and then I made it worse by doing bed rest and rugby.
Yeah.
To the point where I actually
Aaron and I met playing rugby, so that's our sport together, and I can attest to he was pretty banged up. There were some times Aaron was one of our best players. If we handed him the ball, like he would just truck somebody, and we would get solid amount of yardage. And we reserved Aaron. He was in a lot of lower back pain, and we purely reserved him just for a play or two. And we're like, hey, we need you to truck this guy.
Yep.
And that's not a joke. And we're like, all right, the ball's going to Aaron when he's on the field, and then he would unfortunately get injured, and we'd have to pull him out.
Yeah,
so he'd be good 30 minutes later.
If it makes sense that, I have back pain, and the way I made it better was playing rugby, and I was the person that was the truck. So it is not a good combination with back pain. Actually, I don't know, Dr. Tom, if you know this, but by the end of the season, I actually couldn't run anymore.
I do remember that.
Yeah, I literally was like, I can't play this game anymore. I have to come out because I just couldn't run down the field anymore. So.
Oh, yeah. Also, I apologize. You probably hear this dog behind me that's barking like crazy. This is Cannoli. Come here, buddy.
He's getting bigger.
You want to say hi to all the people? Lower? Yeah, he's a horse now, actually. I forgot to tell you, he's not a dog anymore. He actually has a saddle and everything. Come on up. He wants me to hold the Kong for him. But let's talk about what we
Yeah. How do you know I should probably go to the hospital or more short term go to the doctor? How do we know that it's bad enough to go to the doctor? I think the first, thing you think about is pain. First of all, is your pain getting better? And almost more importantly, is pain getting worse, maybe affecting your sleep at night, affecting how you function? Increased pain at night or pain getting worse is usually a red flag for people like us. If it's staying the same, that can happen for various reasons. It's still not a good thing. It still probably should improve over time. But I think regressing pain and pain at night are probably the two big ones that you're like, okay, something's got to be done here. You might need to go talk to a doctor.
Also, to add in, one thing that we always have to think about too, and I mean, Aaron and I ask it on a daily basis, is pain levels too. So it's like, if we have a constant low back pain, it's like, yeah, it's level 1, 2, 3, it's there. We notice it stops me a little bit. You might be want to still consider seeing a doctor, but if we have those true 7, 8, 9, 10s, and we're having some big problems with it, that's more of an emergency kind of a situation. So we notice the 1 to 3s might not be as emergent, but like Aaron just said, if we're having pain at night, some of these other things, something to think about.
Yeah, like Dr. Tom said, pain level is very important. So when I actually, believe it or not, tend to not ask how bad the pain is because most of the time everyone says 10 out of 10. Okay. But one way I sort of get around that is, of course, no one wants to go to the hospital. when I say rate your pain from 0 to 10, I'll say 10 is so bad that you have to go to the hospital, like right now. And 0 is like, oh, you're great. There's no problem in the world. And when people hear that, they might have said 2 minutes earlier, oh, it's 10 out of 10 pain. But I'm like, oh, then you should probably go to the hospital. Then they're like, well, no, it's not that bad. So you sort of have an
Yeah.
idea like how bad this pain actually is. Like 10 out of 10 pain is really bad pain. It's like otherworldly pain. And it doesn't happen a lot. Although to you, it might feel like 10 out of 10 pain. That is definitely possible. But
It's perspective. It's subjective. It's what you're feeling in that moment, of course.
yeah, it's something that you have to be a little bit wary of. But it's a decent thing to be your first thing to think about when it comes to pain. What else should we look
Yes.
into, sir? What else should we be wary
Well,
of, be careful about?
still expanding on the pain aspect of it. When it comes to lower back pain, a lot of people also experience what we call radicular symptoms, and it's symptoms that extend to other parts of the body. That's also something that can be cause for concern too, because there's a lot of nerves in the back that come out. We have our central nervous system, and we have the peripheral nerves that come out. Now, when we have pain that's extending down the body, typically that means somewhere the nervous system is being compromised, and that's a cause for concern. Anytime there's compromise to the nervous system, it's going to start to affect the muscles. It can affect the blood flow. It'll affect the sensation. It'll affect pretty much everything. You can even affect your balance and your walking too. So if you do have lower back pain and you do notice that it's starting to shoot down your leg or travel to other places in your body, the leg is a radicular type of symptom oftentimes, but there's also referral symptoms. Like if you're having lower back pain, but you're also having pain that's up high and wraps around it because you're being stabbed, that can be a referral pain of some kind of organ type issue too. So pain is obviously it's lower back pain is what we're talking about. So pain is the main thing. But pain and what it's doing is a gigantic factor. It also depends on the type of pain that you're feeling with it.
It could also be like the whole vertebral column spine is connected. So if you're having low back pain, it's possible you have neck pain. That neck pain could also go down your arms. So it doesn't have to be legs. It could even be arms sometimes where you have extra pain that you're not used to. And sort of along the similar lines of what you were saying, differences in sensation, differences in bowel control is a really big one too. Like if you normally have no problem with wetting your pants or wetting your bed, and all of a sudden you get this back pain that's really bad and you lose control over your bladder or your bowels, you probably should go to the hospital ASAP as soon as you possibly can. Even if it's something like you have no problems feeling your feet and you notice, oh, I have a cut on my foot, how did I get that? Or there's little things that you're not feeling how you usually do. Like when you put a sock on, you could feel the sock coming on. But if you try putting it on, it's like a lead foot. Some people have even described to me like their feet feel like sponges. That's also because of peripheral neuropathy, but that is just giving you the idea of how it might feel if your sensation is all messed up because of even your back.
Yeah. And it's really hard to categorize into like, oh, like is there something that's most important I need to watch out for versus others when we're talking about these categories? Like, oh, is the length of time the most important? Is the type of sensation the most important? Is the location of the like where along my lower back is important? And it's really a gray area. It's really dependent on the person and what they're feeling in that situation. So that's why Aaron and I are kind of talking more broadly about it versus like narrowing in like this is the first thing you need to focus on. Realistically, they all have their own reasons on what makes them potentially emergent.
Yeah, like there could be hundreds, if not thousands, of reasons why pain can happen. And there could be a lot of reasons why you should go to the doctor or even go to the hospital because there's such a bad issue. But I think we're just trying to give you things to look out for and things like, okay, you should really do something about that. Like we said, bowel, bladder, you should really do something about that. If it really is a 10 out of 10 pain, you should really do something about that. If you're not sleeping at night, you should really do something about that. Those are big ones that you should really do something about that.
Accidents. accidents, not even just like car accidents, not just your slip and falls, any type of traumatic accident, traumatic blow to the lower back where you start to experience pain is something we need to consider. It's like I have a lot of patients who come in and they are motor vehicle beats, meaning they got into a car accident. One of the first questions is I always ask is, did you go to the emergency room? And I'm always hoping, even in the little fender benders, that if you're having lower back pain immediately after an accident, that they still go to the ER to get checked out because it sounds funny, but we've seen some crazy stuff happen even from the smallest little accident. The accident can feel small. You have to think about the total amount of force from that car. Like you're driving a car and you're going 40 miles an hour, and then all of a sudden, bam, it goes to a complete stop. That's a big accident. There's a lot of force that has to get stopped, but there's still a lot of force that has to get stopped even in those little fender bender 20-mile-an-hour accidents. It doesn't seem like it's a lot. You're like, oh, I can kind of brush it off. But we don't really know what just changed dramatically in your back. It could just be a simple like bump force, and next thing you know, we've got a disc that slipped, or and now we've got a nerve that's impinged, and we don't know it until it's far a lot longer.
Yeah, so that makes me think of a few things. First of all, not just like car accidents, really any accident. You fall, you hit your head, you're in a car accident, you're playing a sport, hit your head harder than you think. There's a lot of reasons, like with something traumatic like that, you probably should go get it checked out. Like a good example is my papa, if he's watching. Maybe he is, maybe he's not.
He definitely is. He's watching the premiere. I know Mr. Muller's watching the premiere. He's the one viewer we get a week.
I hope so. But he was climbing a ladder last year, and I forget what happened exactly, but the ladder fell. He fell backwards, hit his noggin, and he said, I don't know if I really need to go to the hospital. I was talking to him on the phone for some reason, because he's my dad probably. And I was like, you can just go. Get it checked out. It's better safe than sorry. If there is something like he had his bell rung a little bit, so he was a little bit like headache. And he went. They did an MRI. He was fine, and that was that. And you know what? Even though he was fine, it's better that he went and checked than get a brain bleed or something like that can have longer effects later on or be potentially life threatening. I had a patient actually who. I'm going to change the story a little bit just to keep them unanimous. Had a son.
Protected.
This patient had a son who was basically getting his luggage off of the like a little area from a train. Like he was picking it up, fell, hit his head, didn't think anything of it. Turns out he actually got a brain bleed when he did that. And died that night in bed. And he wasn't an old guy or anything like that, middle-aged guy, never saw it coming. It was just bonking his head, something like that. It's a very extreme example, but it's something, it shows why like you should really get that stuff checked out. Obviously, if you let it down, it hits you like barely anything, you probably don't need to do it. But if it hits you pretty hard, you get your bell rung a little bit, even if it's like moderate and you're like, I don't really know, you should probably get it checked out. Maybe just go to an urgent care or something like that. So
yeah, I mean, listen, the same thing can happen to your lower back, even though like it's usually we think it's a pretty solid area with the bones being pretty large. Freak accidents happen, and unfortunately, these stories also happen. It's incredibly sad, and I'm very sorry for your patient's loss. But that's why it's important that we take advantage of the tools that we have.
Yeah, thanks for bringing us back to low back. I got sidetracked completely.
No, but it's still an example of, and eventually we'll do a next segment, I'm sure too. But it's still an example of like what we think is a small accident that might not mean anything, and look at what can happen. And we're not to try to like scare people into like, oh, like you said, like I bent down to tie my shoe and threw my back out, I got to go to the ER. It's all dependent, of course, but it's something to think about and consider. But yeah, other things. We can get into some more.
1 second, sir. Before you go to the next one, I'm going to circle back one last time to like pain after an accident. Sort of relating it back to the first thing I said. When you have a lot of pain and it's getting worse and worse and worse, there's probably something wrong. Like, let's say a normal instance, I fall, I hurt my back. It's going to probably get better over the next few days. But if over the next few days it gets worse and worse and worse, after, of course, the day or two of initial like extra soreness, there's probably something wrong. Pain shouldn't get worse and worse and worse over the course of a week.
Yeah. Cannoli is here for some little comedic relief as we're talking about some serious stuff. So hope that makes everybody feel better about their backs. But Aaron, you make a very good point. We can dive into a little bit of more of the what I would call and categorize are the extremes, meaning like there's something really going on and we really need to get it checked. We're running a fever, and over-the-counter medications aren't cutting it. They're not cutting our fever down. We have this back pain. It feels stiff. The neck feels stiff. A lot of the times we find that that's a high risk for infection inside the actual spinal cord itself, inside the spinal canal. That's when we get nervous, and that's an immediate ER run. We need to get there. There needs to be serious medical treatment. That's definitely one that you need to keep an eye out for. It's not as common, so it's not something that you need to worry about with your accidents, but there are some risk factors that we have to kind of explore with that too.
And then adding on to that, unexplained weight loss. You lose weight super fast out of nowhere. Similar idea. Like, let's say unexplained fast weight loss is like in a week you lose 10 pounds or something like that. Even 5 pounds in a week is an extreme amount of weight loss that you shouldn't be losing off of a whim. That usually indicates that there's something wrong. So that coupled with back pain out of nowhere, especially with insidious onset, that makes you think, okay, something else might be going on here. I probably want to get that addressed sooner rather than later. And I know we mentioned it before too, but like the loss of bowel and bladder continence or ability to control it probably goes in the same category as like fever, rapid weight loss, that it's like, you really need to do something yesterday.
Oh, definitely. The one that you were just mentioning, the
Weight loss?
sorry, brain fart. Yes, thank you. The weight loss one. Again, not to scare anybody, but it's just more so the seriousness behind it is that those are common signs for cancers, that there could be something really going wrong. And we always like to mention these to even our patients. Even I mention it to even my patients when I'm going through evals, and if they don't even have those symptoms, they're like, oh yeah, no, like no sudden weight loss. I just educate them and say, hey, listen, like if this does ever happen in your life, I'd rather you know early signs and symptoms of it. But it's a sign for cancer, and I need you to get checked out ASAP.
Yeah, better to check it early than to check it too late. So,
Exactly. It's one of those things where it's like, it's just good knowledge to have.
yeah. I think that we had a pretty good review of the big things you should look out for. We could try to summarize, but it's hard to say like little things like we said. Honestly, I would just look back at the video, see what we had to say, use it for your own knowledge, for your own benefit. Let's just wrap it up, sir, with if you had one tip for back pain and how to improve it if a person has it without doing anything yet, what would you say it would be?
Now, you asking exercise-wise or just general tip overall?
General tip. Tip to give anybody.
I would say it's going to sound dumb. I work a lot of, obviously, as physical therapy. I give a lot of exercise. I do a lot of manual therapy in the orthopedic realm. But the one thing I constantly preach is a lot of just the psychological aspects of it. So if you're dealing with lower back pain, I know it's going to sound, it's going to be frustrating, and this might not be what you want to hear, but just try to remain as calm as you can. It can get frustrating, but the more anxious we are about it, the more upset we are about it. We typically find that our bodies react in a sympathetic way, meaning everything wants to just tighten down, and a lot of the times that makes those symptoms worse. So just remember to just stay calm. We're going to address it. It gets better, and it will go away with time.
Yeah, stress is a big factor with pain. Your brain is a big factor with pain. So if your brain is overactive from stress, it's probably going to affect your pain level as well. I think the biggest thing I would say is that you hear it probably from every physical therapist: hurt doesn't equal harm. So just because your back is hurting doesn't mean you're making it worse. It just means it hurts. Your brain is hypersensitive. Your muscles are probably a little bit tender. Your nerves are even a little bit tender. It's okay to move. Just because it hurts doesn't mean you shouldn't do anything. You should always try to do something. You should keep yourself moving. Moving is good.
I love it. I love it. I love it. Just to end with, I would just say, listen to your bodies too, especially with all the symptoms and things that Aaron and I just laid out. If you're experiencing any of these, if you're watching this video and you're like, wait a minute, they just mentioned something that I also have, listen to your body. You know, 99 times out of 100, what your body is telling you, and you need to just listen to it and give it what it's asking for.
Sounds good, sir. We could probably talk about this all night, but we'll wrap it up
Okay.
there. Thanks, everybody, for watching. We will see you soon. Our next installment of low back pain extravaganza is going to be about low back exercises, whether they're beneficial, what could be better, what are they working, all that jazz. Have a nice night, everybody.